Good morning, everyone. Janelle Tennyson here with the Joint Replacement Academy. I'm here for another coffee time video. And I have to tell you, this is just a little bit out of my comfort zone. In my hospital, part of my job is to work in the public representing my hospital and the company that I work for in the hospital part of things, not the Joint Replacement Academy, but on the hospital end. And I work with the marketing department, and I've developed a really in tune eye with kind of how things work and trying to make everything really look nice and represent well. So rolling out of bed in the morning, not doing my hair and makeup, just brushing my teeth, making my coffee, and turning on record on my video is not very natural for me. So I think it's still a good idea, and I'll probably keep doing it, but I just want to let you know this isn't natural for me. What I wanted to talk to you today is about postoperative urinary retention. And I don't want to over talk about this, and I'm not going to, but it is a topic that I am super passionate about. In my job at the hospital, I'm responsible for educating my colleagues about taking care of patients that have had joint replacement surgery. And a big part of my education is educating them about the dangers of postoperative urinary retention, secondary to a variety of factors, but mainly spinal anesthesia. I love spinal anesthesia. I think it's a wonderful idea, but this is one very strong possibility that can happen as a result of spinal anesthesia. So I was on Facebook yesterday, and I do this quite a bit just to learn about the experience of joint replacement patients in other markets, other part of my country, and other parts of the world even, because I think it's good for me to improve the care of my patients at the hospital and my clients at the Joint Replacement Academy. There was a discussion a couple days ago about asking what types of incontinence products are best to use right after total knee replacement surgery. It was a really good discussion. There were a lot of, very honest and, good suggestions, primarily for women. But then one lady commented, she said, I don't think you're going to need any incontinence products. She said, I personally only experienced one episode of urinary incontinence. It was a huge amount, but it only happened one time and never again. Another lady commented, that same thing happened to me. She said, but I was with my nurse at the time, and my nurse reassured me, don't worry, this is normal. It happens all the time. Well, my friends, that is not normal, and that is a very obvious case of urinary retention, probably due to spinal anesthesia. So if you think about when you have spinal anesthesia, the effects of that numbing action from the spinal wear off over time, and the sacral nerves, which are at the bottom of your spine, are one of the last bunches of nerves to wake up. Those sacral nerves are responsible for giving you the sensation that you need to urinate, and then it also is responsible for the voluntary part of urination. So if I'm sitting here recording and I feel like I need to urinate, first of all, I can sense that I need to. I can sense that my bladder is getting full. And I can also say, well, wait a minute, I'm going to just finish recording this video, and then I'll go across the hall and I'll urinate. Well, that's the voluntary part. But the automatic part of urination is kind of a safety backup and a safety check, so that if that bladder gets extremely full, your body will take over and expel an amount of urine to reduce that tension in the bladder and to reduce that volume. If that happens, certainly on a regular basis, but even one episode of severe urinary retention can either mid or even long term, on a long term basis, damage that detrusor muscle in your bladder that gives you the control and that gives you that ability to control that urination. So before you have surgery, I really, I implore you, I beg you, ask your surgeon what will be done to assess for and to manage postoperative urinary retention. And if that question, it should be very automatic, very sure, and very decisive. If the question takes him by surprise, that's not a good sign, and you're going to have to kind of advocate for yourself, maybe learn a little bit about it on your own. I have a little bug here. You're more than welcome to send me a private Facebook message, and I can give you some ideas of things that could or should be done in your care after surgery with regard to this. So have a good day, everyone, and I'll see you soon with another coffee time video.